Welcome back everyone. Today I want to show you some core exercises that you should be able to do almost any day. These exercises will help strengthen your lower back muscles, your abdominals and your glute muscles at the same time. A lot of times we think core exercises is only for our six-pack muscle, but realistically if we have very strong lower back muscles and weak abdominal muscles, it's a very uneven tug of war, and that's a recipe for disaster. We have poor posture and probably can cause distal cross syndrome, where there is a lot of stress and strain in the lower back and causes pain in the lower back and refers down the leg or into other areas. It can also progress on to become arthritis or degenerative change that could promote disc herniations and disc bulges that can press onto the side nerve and then causes sciatica down the legs. This video is designed in a way where the exercises are easier at the start and then harder at the end. There'll be modifications on the exercises as well to allow you to be able to do it either easier or harder. I hope these exercises help you as much as they help me and my patients.
Plank hold. Go on your feet and elbows and then raise your hips off the floor. Have your elbows under your shoulders to support your upper body. Now in this position, squeeze your core muscles and your bum muscles so that your lower back flattens out. The upper body and the shoulders should be almost like a plank and almost parallel to the floor. This creates tension in the abdominal muscles that will help prevent lower back injuries. Hold this position for 30 seconds to a minute, then have a 1 minute break and repeat the plank again 3 to 4 sets. If you don't focus on flattening your lower back out by squeezing your core muscles and your glute muscles, your lower back may stoop and promote anterior pelvic tilt and distal cross syndrome. This may cause more lower back pain and even future injury. This is a sign that you may be holding the plank for too long and your muscles are fatiguing, causing your form to break. Just take your time. If you notice that you can only do 10 to 20 seconds, then just do that, but add another set. We want quality of exercises, not a large quantity of exercises that waste your time. This is one of the most popular exercises because it can be done almost anywhere with minimal equipment. However, if done right, it can be quite challenging. I found that I can only hold the plank for a proper sturdy 30 seconds until my lower back started curving and my form broke. Plank modifications. Marching plank. If the traditional plank is too easy for you, try doing the marching plank. Go on your feet and elbows and raise one leg up at a time in a controlled manner, like you're marching. A common mistake people tend to do is they over twist their lower back to help raise their leg up instead of engaging the glute muscles to raise the straight leg up in the air. This will not activate the stabilizing lower back muscles and the glute muscles that play a major role in protecting your lower back from injury and improve functionality of hip hinging and the lower back movements. So please try the best of your ability to not twist your body whilst doing this exercise and only lift the leg up and down. Do this exercise for about 20 to 30 raises and then repeat it 3 to 4 sets. Plank arm raises. If you found that modification too hard, try raising your hand up and down on each side instead of raising your legs. This will challenge the stabilizing muscles of your core by you resisting the twisting in the body to keep your balance. All these plank variations will work on 3 main layers of the abdominal wall, which is the transverse abdominis, the oblique muscles, and the rectus abdominis, which is better known as the six-pack muscle. However, this exercise will work on your lower trapezius muscle and the shoulder muscles more, which is great for shoulder health and upright posture. The marching plank will work more on the glute muscles and the lower back extensor muscles. A good way to keep yourself honest is to do this in front of a mirror or film yourself with your phone camera to reassess yourself. Do this exercise for 20 to 30 raises and then repeat it 3 to 4 sets. Glute bridges. Lay on your back and place your feet flat on the floor, and for stability, place your hands flat on the floor by your side. Then raise your hips off the floor by squeezing your bum muscles as tight as you can. Do this in a slow and controlled manner so you feel every movement without momentum. Try to hold at the end of the movement for about half a second to a second and make sure you activate your bum and your back muscles in your lower back. Try to hold at the end of the movement for about half a second to a second and make sure you activate the bum and your lower back muscles. A common mistake people do is instead of pushing their hips through in a controlled manner and engaging their muscles, they thrust their hips up with momentum, causing them to disengage at the top of the movement, which is one of the most important parts of the exercise. Do about 20 repetitions for 3 to 4 sets. You can make the glute thrust harder by just using one leg instead of two. This will make one leg work twice as hard. This will introduce a balance challenge, as you will need to stabilize against the weight of the other leg not being on the ground, therefore making you activate your abdominals and glute muscles more to stop yourself from falling over. Do about 5 to 10 repetitions on both sides for 3 to 4 sets. Side planks. Lay on your side and raise yourself up with your knees bent. In this position, you will need to push the bottom leg against the floor to keep you off the floor. This exercise will help strengthen the quadratus lumborum in the lower back muscles and activate some of your core muscles such as the obliques. The quadratus lumborum plays a major role in helping you flex your back and twisting your back, which is crucial in daily tasks and sports. Such tasks like picking up a child or lifting groceries from the floor and then turning and twisting and putting in the back of the car. Hold this position for about 30 to 60 seconds, 3 to 4 sets on both sides. If this is too easy, you can do the full side plank by extending your knees out all the way. This will increase the amount of torque you will need to produce to hold yourself in a stable position, since your legs are now adding more weight to the exercise. If you find yourself wobbling or losing balance, you can help stabilize yourself with the other hand. Just use your fingertips. Otherwise, if you use your whole hand, then you're adding another limb to help you stabilize and therefore taking out the challenge that you may feel in your core. Side raises. If side planks are still too easy for you, you can do side raises instead. So let's go into a full side plank position and raise your body up and then slowly back down. This will work on the same muscles as the side plank, but in a more dynamic manner. What is special is that this exercise will flex the spine back and forth, allowing nutrients exchange into the joints of the spine, such as the intervertebral discs, which thrives on being hydrated. This will allow the discs in the spine to heal and be able to support the body much better, preventing injury and pain in the back. If you feel like you need some assistance from falling over, you can always use your fingertips with your other hand to give you some balance. Do about 10 to 20 side raises on both sides, 3 to 4 sets. Bird dogs. Kneel on the floor with your knees shoulder width apart and under your hips supporting your body weight. Place your hands under your shoulders with your elbows locked out. Now raise your opposite arm and your opposite leg at the same time in a slow and controlled manner. This may put your body off balance since there is two limbs not helping you hold your body up. But please try your best to stay stable and use the right muscles throughout this exercise. Do this for 10 to 20 repetitions, 3 to 4 sets. If you want to incorporate some front abdominal strengthening exercises, you can draw the opposite knee to the opposite shoulder and touch them together on each movement. This will make the bird dog slightly more difficult since you'll be spending more time on two limbs whilst flexing and extending the back during this movement. This may expose your weakness on which part of the movement is weaker and needs more practice. Is it extension on the back or is it flexion of the back? You be the judge. The main muscles that we'll be targeting is the glutes, the lower back muscles, and the upper back muscles in a contralateral manner, meaning opposite sides. This is really important since most of our bodily movements usually supports the opposite limb, such as throwing a ball where you lead with your front foot and throwing with your rear arm. Back extensions. Lay on your stomach with your hands behind your back like how you would get arrested. Then raise your chest and head off the floor. Try to squeeze your shoulder blades together, lower back muscles, and your bum muscles. Then relax back down, resting your forehead on the floor. I like to have a rolled up towel to rest my forehead against the floor so I don't keep headbutting the floor. Do 10 to 20 repetitions for 3 to 4 sets. To make the back extensions harder, you can place your hands next to your head with your elbows sticking out and then do the back extension. This will add more torque on the lower back with weight on the upper end of the body, making the exercise harder. This exercise will work on mainly the lower back muscles, the mid back muscles, and the glute muscles. The back extension is rarely given as a core exercise, but the main muscle that it works on helps you lift yourself up off the floor and pulling things off the ground. So strengthening it is very important to prevent yourself from getting injured and enjoy your life. In 1993, the Spine Journal published a paper on how lumbar strengthening affects lower back pain patients. The results showed that lumbar extension exercises is beneficial for strengthening the lumbar extensors and decreased pain and improved perceptions of physical and psychosocial functioning in chronic back pain patients. So please try to do back extension exercises and strengthen up the lumbar spine and not just the abdominals in the front. You'll gain a lot more benefits by doing this.
Once again, thanks for watching. Now, I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll try my best to answer them as soon as possible. There'll be other health professionals in that group as well to help you out. I'll leave a link in the description box below. Now, if you found this video helpful, there could be a chance that you are suffering from upper back pain from poor posture or poor mobility in the thoracic region that can cause pain in the upper back, the shoulders, or the mid back. There could be referring pain to the lower back as well. So check out my upper back pain exercise video. That video will definitely help improve all those things that I mentioned. Now, if you do have a lower back pain, I want you to check out my best sleeping positions for lower back pain video. That video will help you get a better night's sleep and possibly even recover better from lower back pain. Remember, support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.